So the upper part of this form are the key pieces needed for us to be able to create an account in Athena. Most of our patients coming through will be Summit patients that already have an Athena account. However, we will have some non-Summit patients coming through. And so that's the purpose of the top part of the form. The medical questionnaires, which we're going to be reviewing with the patients, have been reordered because the top 4 questions, and there's an asterisk and they're bolded, if there is a positive answer to any of these 4, they will not be vaccinated. They cannot be vaccinated. And so, are you feeling sick today? Now, there's a little judgment there, but I spoke to somebody who wanted to get vaccinated, but she's on antibiotics. Well, by definition, that means she's being treated for an infection, so cannot have the vaccine. So if they're currently sick, they should not be vaccinated. If they are in the 10-day window after a positive COVID test, they cannot be vaccinated. If they were diagnosed with COVID and are still having symptoms, they should not be vaccinated. Question 3, did they receive monoclonal antibodies? Because we're unsure of the interaction of the antibodies and the vaccine, it's recommended to wait 90 days after receiving monoclonal antibodies. So we will not vaccinate them. The 4th one is asking, had they gotten any vaccines in the previous 14 days? That includes tetanus, flu shot, pneumonia shot, etc. Any vaccine in the past 14 days means they cannot get the COVID vaccine. The next 4 questions are more judgment is required. Number 5, have you had any serious or life-threatening allergic reactions? We're most interested in someone having a history of having an anaphylactic reaction from an injection. So somebody who broke out in hives after receiving penicillin is not a severe reaction, and it does not invalidate them from receiving the COVID vaccine. So if you have any questions, there'll be doctors and experienced folks that can help review that. It's always a good idea to review questionable things with the group. In addition to this video, there's new content that has come out, recommendations from the CDC regarding those patients who have had an anaphylactic reaction to any food or injectable medicine or oral medicine. So someone who generally has to carry around a EpiPen is someone who, by definition, has had anaphylaxis or at high risk for that. And for those patients, if you're going to vaccinate them, you want to have them wait 30 minutes after receiving the COVID vaccine rather than 15 minutes. Otherwise, it's up to the level of each site regarding your comfort level dealing with potential anaphylactic reaction. You should have more than 1 dose of epinephrine ready for such a patient, as well as a way to ventilate the patient, and of course dial 911 if you get a true anaphylactic reaction. I hope this video has been helpful. Thank you. Number 6, we're not going to need to worry about yet, but this is an elderly population. In general, though, for your understanding, the Pfizer and Moderna vaccines were not tested in pregnant women, not tested in lactating women. Because it is a messenger RNA vaccine, it is not a live attenuated virus. It's considered generally safe in pregnancy. It just has not been tested. So if a patient shows up and is pregnant and would like to be vaccinated, it's important to tell them that this has not been tested in pregnancy. While we believe it's safe, it hasn't been tested, just so they understand that. The next question, number 7, do you have cancer, leukemia, HIV, AIDS, any other autoimmune disease that suppresses the immune system? And the purpose of this is so that we can have the conversation with the patient and they understand that their illness may cause the reaction to the vaccine to be less strong of a reaction. So their immunity may not achieve that 95% efficacy like was shown in the studies. And it doesn't mean we should not vaccinate them. In fact, I would argue that we for sure should vaccinate them, even if we get a 50% response. It's much better than no response. And there's a good article we just read after our last vaccine clinic that confirmed that. The next is, are they taking any medicine such as cortisone, prednisone, anti-cancer drugs that may suppress their immune systems, or having any radiation treatment? Same discussion. These medicines reduce their immune system. I did read one article that said if they're on a dose of, steroid higher than the equivalent of 7.5 milligrams of prednisone per day, that the reaction to the vaccine may be suppressed and we may want to wait. However, if the patient has a chronic illness, maybe they have COPD, for some reason where they have to be on a chronic low dose steroid, still vaccinate them. They're obviously high risk if they get COVID, and we want to get some protection for them. So anyway, those are how you would answer those questions. That's why we wanted to create this video.